Welcome to the Joint Intersectoral Analysis Framework, or JIAF 1.1 session on process. The JIAF is a multi-partner endeavor that brings together UN agencies, NGOs, and donors. This session is part of a broader training plan for JIAF 1.1. The plan is composed of 3 elements: 4 high-level pre-recorded presentations, 8 more in-depth blended sessions, and workshops and webinars. The first set of presentations are 4 high-level, 20 minutes maximum pre-recorded presentations. They focus on 4 thematics. First, a broad general overview. Second, the JIAF concept. Third, the JIAF methodology. And fourth, the JIAF process. This presentation focuses on the process. The JIAF is part of a humanitarian program cycle. It is actually the approach that underpins the HNO. And now let's start digging on the JIAF. Concretely, the JIAF approach consists of 3 elements. First, a concept. Second, a methodology. And third, a process. The concept is that the analysis is intersectoral, as opposed to multisectoral, with affected people as the starting point, and we'll get back to that in the coming slides. The methodology is articulated around 3 elements. First, an analytical framework, then indicators with severity thresholds, and third, an aggregation method for each of the data scenario that your team can face. The aggregation will then lead to the calculation of the number of people in need. Finally, in terms of process, we will see that it is very similar to the HNO process with which you're already very familiar. Let's now zoom in on the process. This slide recaps the entire JIAF process, and we will now go into more details step by step. The very first step of a JIAF is to plan and design a joint intersectoral analysis process. This starts with the formation of the analysis team. Pragmatically, the analysis team is composed of the Intercluster Coordination Group, as well as the Information Management Working Group. In some countries, there are also assessments and analysis cells, and they should also be included. Other partners who can bring additional expertise and resources are also welcome. Once the team is formed, the next step is to set and agree on a time frame for the joint analysis, as well as roles and responsibilities. Documenting roles and responsibilities is good practice to ensure transparency and accountability. Once this is done, the team should review existing guidance and templates to ensure they are working with the latest available material. Next is setting the scope of the JIAF analysis. This is the first dive into the first 3 pillars: the context, risk, and impact. It is usually best done through a workshop, so the various stakeholders can come together and discuss the boundaries of the analysis, whether it be geographical or groups of populations. Once there is agreement on the scope of the analysis, the next task is to review indicators and define their sources for the humanitarian conditions pillar. We strongly suggest the teams to consult the JIAF indicators reference table at this stage. Among the chosen indicators at country level, the team should then identify the critical indicators that will play a critical role during the expert judgment phase. More guidance on the use of critical indicators was developed and is now available in section 2.1.6 of the JIAF 1.1 guidance, including examples of critical indicators. Finally, all this should be recapped and presented for endorsement to the ICCG and HCT as the scope for the HNO. The output of this first step is a reviewed analysis framework and a work plan for the JIAF. Step 2 of a JIAF is to collate and collect the data. Existing data can be organized through a secondary data review, and this could be done using the DEEP. The DEEP is a humanitarian secondary data review and analysis platform. You can discover it and start using it at the address thedeep.io. Alternatively, you can of course proceed with an Excel matrix. The secondary data review exercise should highlight information gaps. In the event that information is not available and if there is time and resources, the team can explore the possibility to conduct a joint needs assessment to collect primary data. Once all the data has been collected, either through a secondary data review or a joint assessment, the next task is to review it and start to tell the intersectoral story. The last part of this step is to identify which data scenario will be used for the humanitarian conditions indicators aggregation. The output of step 2 is to have an initial intersectoral analysis narrative that will be extended in later steps. Once data has been collected to inform the indicators, it is time to aggregate all the information and start looking at estimating the number of people in need. Two scenarios, called Scenario A and Scenario B, have been developed to support the aggregation of indicators. The scenarios are determined based on the availability of JIAF indicator data, in particular whether data is available at household and/or area level. Data Scenario A is easier to implement and allows for a full breakdown of population by severity class, which is unfortunately not possible for Data Scenario B. However, Scenario A shouldn't be pushed, and no data should be discarded. If you have multiple data sources and indicators are unlinked, you must use Scenario B. Furthermore, the sectors can choose to recommend non-MSNA data source, and this should not encourage MSNAs. See the guidance, section 2.2.4, and I quote, "If a specific JIAF household level indicator has multiple sources, for instance, MSNA and sector-specific assessment, the concerned sector should be able to decide which source should be used for that indicator." Once you've identified which scenario you're going to use to consolidate your data, you go into step 3 and actually consolidate the JIAF data. This will yield the first estimates of a total number of people falling under each severity phase and gives you what we call the preliminary PIN. We will go into more details in another session on the methodology for aggregation and on the aggregation method for each of the scenario. This step output is the preliminary PIN, which is based on quantitative data aggregation only. For JIAF 1.1, the JIAG has developed several tools to facilitate and make the aggregation process easier. In the companion documents, you will find a data aggregation tool that can be used to collect the data from the clusters and aggregate that information into a data aggregation tool. Once the data has been collected, and aggregated, the next step is to use it by conducting a joint intersectoral analysis. You can start by reviewing the narrative developed a bit earlier in the process and explore the linkages between the various pillars, looking at the description of people's humanitarian conditions and factor associated. That was step 2.2.3. looking at the preliminary PIN and the severity phase estimation. This review is the joint analysis that is done during a workshop. The idea is to bring together the various experts to scrutinize all the information that has been collected and aggregated to ensure that it makes sense. During the workshop, several different working groups could explore each key issues, characteristic, contributing factors of people in need. Finally, review existing risk analysis and anticipate future conditions. The output of this step 4 on the joint analysis is a refined joint intersectoral analysis narrative, a reviewed intersectoral PIN, and projection that can be used for the planning phase. The last step of the JIAF is to validate the analysis. It's quite straightforward. The JIAF team aggregates all the analysis results, validates the main conclusion from the workshop, and submits the final outputs to the ICCG and the HCT for a final validation and endorsement. Once this is done, the JIAF is ready to be transformed into the HNO. This concludes the high-level session on the JIAF process, which is part of the broader JIAF 1.1 training plan. Stay tuned for other sessions.